Welcome to Tissue Engineering and Regenerative Medicine. We are honored to invite Dr. Rosenthal for interview. So, dear Dr. Rosenthal, could you briefly introduce yourself to our audience?
I'm Professor Nadia Rosenthal, and I'm the scientific director at the Jackson Laboratory in the United States.
Yes, could you briefly review the immune potential of tissue repair?
The immune system plays a very important role in our response to injury, and it has a kind of a dual function. On one hand, it has to take care of the injury and the infection that would happen without the immune system. But on the other hand, it has to limit the inflammation and help the tissue resolve the wound. And this function of the immune system is probably what is perturbed when we can't regenerate our tissues as well. So we are interested in the lab to figure out what it is about the immune system of organisms that can regenerate very well, and understand how we might be able to help our immune system to regenerate in the same way.
Okay, well, do you have any insights or future development into regenerative medicine?
Well, I think what we're interested in my laboratory is to understand what are the signals that maintain the animal in a state where it can regenerate its heart or its brain or its spinal cord. We're very good at doing this as embryos and as young animals, and then we lose that capacity. So we want to understand what is the signaling that goes on in an early organism or an organism that can regenerate well, and apply that to therapies for patients.
Okay, so what are the outstanding features of all those laboratories you have established or you are now directing, such as EMBL and Jackson Laboratory?
Each time I get involved in directing a laboratory, I pay attention first to the young people because it's the early students and the postdoctoral fellows who are going to be the scientific stars of tomorrow. So both at the EMBL and in our institute in Australia, and now at the Jackson Laboratory, we are focusing on training and promoting the careers of young scientists.
Okay, so what drives you go into the field of cardiovascular science and regenerative medicine?
I think it's a very exciting area to be in. Imagine if we could cure ourselves of heart disease, if we could figure out a cure for Alzheimer's, if we could perhaps make traumatic injuries something that could be easily healed. This would really change our lives, and it would also change the economy. Older people are particularly susceptible to the kinds of degenerative diseases that regenerative medicine is trying to cure, and so we would also be able to extend our healthy life.